Hello, my name is Michele Bullock. I bring you MBLEx resources both here on YouTube and also from my website. I've got a bunch of free and paid resources to help you pass the MBLEx with calm and confidence. That's the Massage and Bodywork licensing exam. Right now I'm working on an Anatomy and Physiology series, and I'm moving into the skeletal anatomy function and structure section. And I wanted to create a supplemental for all of you guys of all the important bones and their landmarks. All right, so I created an atlas of bones and important landmarks for body workers. That's going to be available in the first pinned comment, and it's a link from there, and also there's going to be a link in the description of the video below this. You'll find a link to all my free resources. It's going to be in the link tree, but I'm going to just do a separate link as well so that you guys can get straight to it. Now, in this atlas, it's 18 pages long. I go through each region of the body and talk about each of these. I point out in the atlas, point out each of these bony structures that you're going to need to know. So that's just a quick skim over. Now, in the rest of this video, I'm going to be going onto my complete anatomy software, and I'm going to be talking about each of these bones and the structures that you need to know for them. And that's in order to pass the MBLEx. But first, before we get started with that, I want to talk about bone markings and the definitions for each of those. And then we'll just go into the rest of the video. So first thing to know is the parts of the bone. We've got the head of the bone, epiphysis, that's the bulbous end. And typically this is for a long bone, the parts of the long bone, because there's all kinds of different kinds of bones. I'm going to talk about that in my skeletal system video. But we've got, the head, the neck, that's the metaphysis. That's between the epiphysis and the body, which is like the shaft, right? The diaphysis is the name for the shaft. And then we have the articular surface, which is like the area where the bones pivot together. So talking about bony projections, here's the glossary for bony projections. A tubercle is a small bump. A tuberosity is a large bump, okay? So we've got like the deltoid tuberosity that's on the side of our arm. We have the, greater tubercle that is on our shoulder, on our humeral shoulder. Humerus. What happened to words today? And then the trochanter is the bump, the small bump on the hip that a bunch of attachments go to. That's the point, is that these bumps are where you have muscular attachments, and that's what's important about them. And then, so small bump, large bump. And then condyle is a rounded projection at the end of the bone where the other bone pivots. So specifically, we have condyles on our elbows and knees. And then epicondyle is a bump that goes above that condyle, where muscles attach to wrap over the whole joint to make that lever happen. And then a process, when we're talking about the styloid process or the olecranon process, it's like a bony projection, something that sticks out for the muscles to attach to. So the needle-like styloid processes, we have those at the sticking out of our temporal bone. There's a needle sticking out of there, and then we have two in our wrist on our ulna and radius. So needle-like projections for these processes. And then a crest is a sharp ridge-like edge of a bone where the muscles attach. So we have an iliac crest on our hip. And then for depressions, coming down to the depressions section, a fossa is a place where there's like a scoop out of the bone. So, for example, on our clavicle, on our scapula, we have three different fossa: infraspinatus, supraspinatus, and then the subscapular fossas. So they're just like a teacup or a tea saucer that you put your cup on top of. They're just kind of shaped like that. And then a facet is a flat surface where bones move together. So like in our vertebrae, we have some facets. I'm going to go through and talk about those. And then for holes in the bones, we have 3 different names. We have foramen, which is like a hole in a bone for blood vessels and nerves to go through. So we have the obturator foramen in the pelvis, and also we have all those foramen in our vertebrae. And then we have the meatus. I talk about one that's a little hole in our cranium that helps us to be able to hear. And then we have the sinuses in our face, which is for catching. There's mucous membranes in there for catching all that stuff to keep it from going into the rest of our respiratory system. So with that, I'm going to move on to the actual show where I talk about the bones with my software. So everything's going to be turned around, so you're not going to be able to, you'll see me, but it's in a much smaller screen and I'm in a different room. I recorded it already. But yeah, this is just an introduction. So we'll go ahead and get started with that. Make sure to get your download for that atlas, and I will see you over there. Okay, so we can just go ahead and get started talking about the bones of the cranium and then just a little bit about the facial bones. In the atlas, I have the facial bones listed for the most part, not quite all of them, but just the ones that you can see. But those are going to be a lot less important on the MBLEx than knowing the individual cranial bones. It's good to know that if you see these facial bones listed, that they do belong in the skull or in the face, but having them memorized is a lot less of a priority for you. Remember that knowing the bones, it's like a little bit kinesiology, a little bit anatomy and physiology. Either way, it's going to be a very minor part of the MBLEx, but to get all the points possible is a really good thing. So there are 8 cranial bones and there are 14 facial bones. Part of the facial bones would be that mandible and the maxilla. So those are considered facial bones. Those are 2 that you're going to need to know. The zygomatic bones are important to know. The frontal bone, knowing those bones is very important. The hyoid bone is good to know. That's that little floaty that's on your throat. If you like open your jaw up and down, there are muscles that attach in there. So that's important to know. And then so the temporal bone that's on the side, but a little bit of sphenoid is going to be right in that little temporal divot. And sphenoid, we're going to open up the cranium so we can see inside that the sphenoid goes all the way across. There's one bone. So temporal bones, there's 2. Parietal bones, there's 2. So as far as cranial bones go, there are 2 of the parietal and 2 of the temporal bones. Otherwise, there's 1 of all the rest. So we've got occipital bone. So 8 cranial bones: frontal, parietal, and then occipital, temporal, sphenoid, and ethmoid is the last one for the cranial bones. And it's easiest to see the ethmoid if I take off that frontal bone. That's the sphenoid. That's the ethmoid. So it's going to be right there in the front. All right. So those are your 8 cranial bones. Going back. Let me just put that. Nope. There we go. All right. So facial bones, just real quick. If I take off the maxilla, we can see some more of these facial bones. So we've got the vomer, which is the bone that's right up under the bottom part of your nose. We've got 2 right and left nasal bones. Those are the ones on the top. And then if we go in, we've got the inferior concha. What else have we got? Lacrimal. There's the lacrimal bones. We got 2 of those. And then, yeah, I already got, palatine. The palatine, there they are. So to put that in context, they're the palate inside the mouth. All right. So I showed you the vomer, I showed you the conchae, and then, yeah, mandible. So we've gone through all of those cranial bones. There we go. Now, I just want to show you a few bony landmarks that you might be quizzed on, who knows. So we have this zygomatic arch that goes through the zygomatic bone, and a little bit of the temporal bone are part of that zygomatic arch, and a tiny bit of the maxilla. let's see. So that's the, and then the zygomatic process is right there on the zygomatic bone. And then this was the other process. Temporal process is going to be, where is it pointing? Put it my, so that's going to be the higher part. All right. Those are all places where muscles attach. So we've got the external auditory meatus. So we've got some auditory organs live in there. So that's that little circle divot. Down here we have the styloid process. Styloid is referring to needle-like, and the process is where a bone sticks out that muscle is attached to. And so speaking of processes, right here we have the mastoid process. And then foramen magnum, which they want you to know is that hole where the spinal cord goes in. Now let me see, did I hit up all of, I did. Condylar process, right there. And then the temporal mandibular joint is where the temporal bone and the mandible join together. And that's the temporal mandibular joint at that spot right there. Ramus of the mandible, right there. Those are the important things for you to know regarding the skull. Let me just take this part of the cranium off. Sorry about bumping the microphone there. And I want you to get a look at this sphenoid bone. So you can see the sphenoid bone is the butterfly shaped thingy. There's the foramen magnum where the spinal cord comes through, and you can see that there's a little bit of it here on your head. It goes all the way across. Come back down here, directing this thing. So once again, this is the complete anatomy software from Elsevier, Elsevier. If you want to get a hold of that, it was $100 a year for me to be able to access all of this information. It's been so useful for helping me to understand anatomy better and to be able to teach it to you guys. Okay. All right. So that's it for the skull. Next, we're going to talk about the vertebrae. Now, in the human spine, there are 33 vertebrae, and that includes 7 cervical vertebrae. We have 12 thoracic vertebrae. Let's going to turn this guy this way. 12 thoracic vertebrae coming from the big bump on the back of your neck all the way down to, come on now, where the false ribs, the last false rib sticks out, okay? So that's the last thoracic vertebrae. And then we have 5 lumbar vertebrae, and then we have the sacrum, which kind of got, it's the tail continues down here, sacrum and the coccyx. All right, so let's go ahead and get started talking about the cervical vertebrae. Now regarding the cervical vertebrae, like I said, we have 7 cervical vertebrae. 1, 2, 3, 4, 5, 6, 7. If you reach back, you feel a bump on the back of your neck at the very base where the shoulder meets the neck. That's going to be C7. So you can always identify it that way and count the spinous processes going up. And right at the base of the skull, you're going to have C1. Let's see. So there's little holes on the side. So these are called the transverse process. And those are the side sticky outies. And then the center back sticky outies are the spinous processes. Inside of, you can see these little circles here inside of these transverse processes sticking out. That's where you can have some nerves and blood vessels coming through there. So veins, arteries, and nerves go through that area that feed the brain. And also there's the spinal cord that's in the center holes. Those are called vertebral foramen, are the center ones. And then the side ones are called transverse foramen. Foramen is another name for holes, as I was saying before. Let's see. Let's see. Axis. It's going to take a second. There it is. I want to get a look at, oh, that's the axis. That's C2. I'm going to go to atlas. There we go. All right, so this is the atlas, which is that top vertebrae. Got all this other stuff going on the sides of this screen, so apologies for that. I'm not sure how to get rid of it. Right here we have articular surfaces. So this is where the base of the skull sits on top of the axis, C1. We've got the transverse foramen and we've got the vertebral foramen. So blood vessels and nerves, and this is for the spinal cord. And then the dens odontoid process sticks inside here of the axis. So let's take a look at that. This is the axis. So this is how I remember how to differentiate atlas and axis. Atlas is going to be at the top, and you know how atlas is holding the weight? So the atlas is holding the weight of the skull. That's how it's C1, right? It's right on there holding the weight of the skull. And the axis has this odontoid or dens sticking out. It's a tooth, dens, odontoid sticking out, and the atlas pivots on it like it's on an axis. Okay, so C2 is the axis. That's how I can differentiate the two. Let's see. There's a cervical vertebrae. So yeah, that's how they all sit together. Let me see if I can see any other important. Okay, so typical cervical vertebrae. Let's look at the fifth one. So here's going to be the superior facet or facet. I've seen it said facet, and here's the inferior facet. And that's how those vertebrae stack together. And this part is the body. And then, of course, we've got the spinous processes here. And I think these are called the necks, but I don't think that's really important for you to know for the MBLEx. Yeah, and that's how they all stack together. So let's go on to the thoracic vertebrae. I'm just going to stay on this screen so you can see it. This is how I have it all set up in the atlas as well. So T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Very much the same anatomical setup as the cervical vertebrae. Look at the thoracic vertebrae. They're pretty similar, all of them. So we've got the superior facet, we've got the body, we've got the transverse processes sticking out on the side, and then we've got the spinous process that's sticking out the center. But these facets are the costal facets. Costal is referring to the ribs. So that's where those set in. So I'm going to show you how it sets with the ribs when we finish the lumbar. So let's get to the lumbar. And you can tell the difference between the two curves. The lumbar vertebrae and the cervical vertebrae both have this lordotic curve, whereas the thoracic vertebrae has a kyphotic curve. Very important for the MBLEx. Just like the thoracic vertebrae, they all stack up the same way, but they just don't have the rib attachments for the costal facets. Let's look at a lumbar vertebrae. That's thoracic. Sorry about that. Let's get to lumbar. There's a lumbar vertebrae. Boop, right there. Looks very similar. It's just bigger. The body's going to be wider because it's going to take a lot more compression from, holding the body up. So yeah, we've got the body, we've got the spinous process, transverse process, and inferior and superior. Get over here. Superior facets. So I guess it's time to get out of that section and go to thorax. Okay, so here's the thorax. I'm going to add some connective tissue here. There. So we got the rib cartilage here added on there. And this is also going to be the cervical cartilage, but just ignore that because we're just working on the thorax here. I did want to show you real quick because we were just talking about the vertebrae. I wanted to show you how those ribs set in. So they sit right on that in the thoracic spine. They set right in between the vertebrae. You see that? So they span two vertebrae. Interesting, huh? Yeah, I had somebody comment that this software was baller. I thought that was pretty fun. Okay, so ribs. We've got true ribs and we got false ribs. We have 7 true ribs and we got 5 false ribs. So let's go through and figure these out. 1, 2, 3, 4, 5, 6, 7. Is that right? No. True ribs 1 through 7. Okay, it says so. 1, 2, 3, 4, 5, 6, 7, 8, 9. Well, Okay, whatever they say. And then we have, for the 5 false ribs, we can start here. 5, 4, 3, 2, 1. All right, so 12 ribs altogether. Hey, here real quick. This is editing mode Michele, and I figured out why I was having such a hard time understanding the terminology of all the different ribs. I looked into another resource and I figured it out. So ribs 1 through 7 all attach directly onto the sternum, whereas ribs 8, 9, and 10, 8 or 10, 9, 8 are called false ribs because they don't attach directly to the sternum. They just, their cartilage fuses into the cartilage of rib 7. And then the last 2 are called floating ribs because they don't have any anterior attachment at all. So I'm really glad to be able to clarify that with you guys. And let's go ahead and get back to the regularly scheduled programming. All right. Here we have the sternum. We have manubrium, sternum, xiphoid process. What else do I want to know? Clavicular notch. Clavicular notch is right here. This little curvy thing, because that's where the clavicle comes in. We're going to look at that in just a minute. We're going to look at the whole shoulder girdle with the clavicle coming in this way. Intercostal space, that's the space between the ribs. Our intercostal muscles span between these 2 ribs. So that's the intercostal space. And that's it for the ribs. Let's look at the shoulder girdle next. Looking at the right arm. Okay, I'm going to take away some of this connective tissue. All right. Well, maybe add a little bit. See if we can see that. There we go. So that's where that clavicular, sternoclavicular joint is going to be. Right there. So I'm going to take away some of that cartilage. Oop, okay. So clavicle, and this is all part of the scapula. Highlight that. Scapula, and there's the humerus, and then of course we got the ribs coming in that way. So there's a lot of stuff going on here, and then in addition to all the musculature coming in here, and then the musculature coming into the shoulder. That's why people get a lot of tension, have some issues, because it gets all clogged up. There's also a bunch of nerves coming through this area. So yeah, lots of noise. We got the acromion process of the scapula. That's the shoulder sticky outie. You can reach over and feel that bumpity bump on your shoulder here. Go a little bit lower, you'll actually be on your humerus, on the greater trochanter of the humerus. But just up above it, just superior, you'll find the acromion of the scapula. And if you come around the front, you feel a little bump there around the front side. That's the coracoid process, named after a crow's beak. That will help you remember. Coracoid is referring to corvids. Glenoid fossa, that's this thing right here. But we'll get a look at that. Humerus. Okay. Take away that. Take away the humerus. Take away the clavicle. I'm going to take these ribs off so we can get a better look at the scapula. Okay. All right. So here we are with a lateral view. We can see the spine of the scapula. We can see the supraspinatus fossa. We can see the infraspinatus fossa. Another fossa that we have is the subscapular fossa. That's what they call it. We've got the glenoid fossa. That's where you have your glenoid joint, glenohumeral joint. Medial border, lateral border, superior angle, inferior angle. Aha. So let's see. I think I got all of it. Oh, another name for the medial border would be the vertebral, and a name for the lateral border would be the axillary border. Supraglenoid tubercle and the infraglenoid tubercle. Yeah, I got it all. All right. Let's see. I'm going to start over with my upper limb. Okay. So I'm going to start working on telling you about the bony landmarks of the humerus. So I want to take this scapula away. I want to take these ribs away. Take that away. Okay. Why not? Why not a couple more ribs? I want to do one vertebrae at a time. Okay. There's the humerus. So right now we're looking at it from the anterior side. We've got the head of the humerus. We've got the neck of the humerus. We've got the shaft of the humerus. You can feel the big bumpity bump on your shoulder when you reach down. You can feel the big bumpity bump. That's going to be your greater tubercle, and the smaller one is going to be the lesser. You see the difference between the greater one and the lesser one? That's why they made that. Somebody was looking at the bone and they were like, yeah, that's definitely greater and lesser. Right there would be the deltoid tuberosity. You see that little baby bump? Tuberosity is a tiny baby bump. Okay, we're going to go further down, distal on the humerus. Here we've got the condyle of the humeral-ulnar joint. Okay, lateral condyle, medial condyle, and then our epicondyles, medial epicondyle, lateral epicondyle. Now, if you hold your arm in anatomical position, that's with your hand out forward, your palm out forward, you can feel the medial epicondyle and the lateral epicondyle. So we might know the difference between a condyle and an epicondyle. An epicondyle is near the condyle. Epi means above. Okay. Capitulum, also the lateral condyle. Capitulum is that name of the big round part. And trochlea is the pointy part of the condyle. And then we'll turn this around. And that is the olecranon fossa, trochlea, capitulum, lateral supracondylar ridge. Let me show you this is the lateral supracondylar ridge right there. That line. Brachioradialis is going to attach there to wrap over the elbow and attach onto the radius. So from the brachial area to the radius, just so you know. Watch out for that thoracic vertebrae. All right, so we're going back to anterior. So that's the humerus. Let's see. So let's just talk about this ulna sitting inside of the olecranon fossa right there. The little thing sticking out. What do we call that? The olecranon process. Olecranon is referring to the elbow, the pointy part of your elbow. Here's where the radius, the head of the radius, sits at its proximal joint on the ulna. And then here on this humeral spot, it just kind of sits. So we got a bunch of ligaments, got a big old joint capsule that holds all of that stuff together with the humerus. Okay, so head of the radius right there. Let's see, let's get rid of, boop, got rid of that humerus. Coronoid process is right there. The trochlear notch, where the trochlea of the humerus attaches to the olecranon. They call that the trochlear notch. Radial tuberosity, the sticky outy here, and the ulnar tubercle. So we've got, so that's the anterior view. Let's see. Going down to the distal end in the anterior view, got a couple things to look at. On the radius, we've got the radial styloid process. Remember, styloid is referring to needle-like. We've got the ulnar notch. Let's see. Ulnar notch. That must be, oh, there it is. The ulna sets into the radius. We call it the ulnar notch. Head of the ulna is on the distal end of the ulna. Head of the radius is on the proximal part of the radius. And then over here, you have the ulnar styloid process sticking out. So ulnar styloid process and radial styloid process. So you know you've got your ulna is always on the pinky side. Ulna is on the pinky side. Radius is on the thumb side. So your ulnar styloid process is going to be kind of toward the back of your hand, the dorsal part of your hand. And the radial styloid process is going to be more toward the palm, and that's going to be on the thumb side. So lots of attachments in there. Okay, let's put that back together again. And we're going to look at the bones of the hand. Okay, so here's the parts of the hand. I'm going to take this guy away. Well, let's just look at this wrist, how the wrist gets put together. Here are the carpal bones, and here is the radius, and here is the ulna. Okay, so they all have a bunch of ligaments that come in here. I'll just show you if it'll show the ligaments. Yeah, look at those ligaments, how it holds everything together. Man, oh man. Okay, so that's how everything sets in there. We can take that one ligament away too. Okay, so let's just go through and talk about these carpal bones. Goodbye, radius. Goodbye, ulna. Let's go through and talk about these carpal bones. These are metacarpals. Carpals and metacarpals. Those are the inside of the bones inside your hand, in your palm. Trapezium, trapezoid, capitate, hamate. That's the one with the sticky outie. Pisiform, triquetrum, lunate, and scaphoid. 1, 2, 3, 4, 5, 6, 7, 8. All right, here's a mnemonic for you. Sally left the party to take Kathy home. So let's start with Sally left the party to take Kathy home. So we're going from the first finger, that's the thumb. We're gonna put our palm out this way, okay? On our right hand, palm first. So we're going proximal first. Sally left the party, so pisiform being the last one, most medial. Going back to lateral again to take Kathy home. Okay, so Sally, scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitulum. Memorize that however you can. Let's just get going on to move on to the metacarpals. So we've got first is the thumb. Number 1 is the thumb. Number 2, pointer finger. Number 3, metacarpal would be the middle finger. Number 4 would be the ring finger. And number 5 would be the pinky. So these are the metacarpals. The joint between the carpals and the metacarpals is called the carpometacarpal joint. Moving on to the phalangeal bones, we got 1, 2, 3, 4, 5. Notice about the metacarpals and the bones of the 2nd through 4th versus the first finger, right? So the first finger has a metacarpal, it has a proximal phalanges, and it has a distal phalanges, and that's it. Whereas all of the other fingers, the other 4 fingers, have a middle phalanges. They have proximal, which means it's closer to the torso, and they have distal. And in the middle is the middle ones. And the joints between these finger bones are called interphalangeal joints. So we have proximal and distal interphalangeal joints. And then the joints between the metacarpal bones and the phalanges are called metacarpal phalanges. Okay. You'll memorize it. Give yourself time. Okay, now we're talking about the pelvis, the pelvic area. Ooh, I didn't finish talking about the sacrum. Let's talk about the sacrum for a second. The sacrum and the coccyx and their landmarks. So let's see. Let's take some lumbar vertebrae away. Whoop. Goodbye. 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 All right, so I'm going to lump in the sacrum along with the rest of the pelvic girdle. Here's the body of the sacrum, but it's also the place where the lumbar vertebrae meet. The lumbar vertebrae attaches to the sacrum right there. And also, this is the superior facet, the articular facet for the last L5 to attach to the sacrum. Now we got some foramen here. We call them sacral foramen. And for the sacrum, these are, even though they're fused together into one big bone, they do refer to each of these bumps as S1, S2, S3, S4, and S5. And then down here, we have, for the coxal bones, we have 1, 2, 3, 4. All right. And then this joint right here, is called the sacral iliac joint, because this is the ilium bone. Sacral iliac joint. Let's talk about the bones, the rest of the bones of the pelvis. So there are 3 bones itchy nose. 3 bones that go on the pelvis. We've got the ilium, which is the top part. Ilium there. We've got the ischium, which wraps around. They're the sits bones where you sit down. So you reach back down between your behind and the seat. That's the ischium. And then we have the pubis, which is that bone that goes around the front. Okay, so those are the 3 bones. Let's talk about the bony landmarks that you should know for that area. Okay, so this is the pubic symphysis. If we add connective tissue here, let's see, oh, I'm taking it away. There we go. So that is a joint there. It's called the pubic symphysis. So I'll take that away. All right, and scoot you back out. And this is, I think it's the superior ramus of the pubis, and then we have the inferior ramus of the pubis. And some important landmarks for you to know for the MBLEx would be the anterior and posterior notches and processes. They call it the spine. So this is a spine and this is a spine. Anterior and posterior. I'm going to take away the sacrum so that you can see a little bit better, and this one too. Okay, so on the anterior side, we've got the anterior superior iliac spine. That's ASIS. Below that, we have the anterior inferior iliac spine. In the back, on the posterior side, we have the posterior superior iliac spine, and we have the posterior inferior iliac spine. Back here, we have a greater sciatic notch, and then we have the lesser sciatic notch. Okay. This is the ischial tuberosity. That's where all your hamstring attachments attach in there. We've got a bunch of adductor attachments in this area. And then iliac crest right there. You've got gluteal line, that little riverbed right there. It's actually, if you felt it, it's a little bit of like a raised ridge. So your glute medius attaches there. And then we have the iliac fossa, where iliacus attaches inside of there. The glute max attaches to the top. All right, anything I'm missing? I think I got it all. Okay. All right, moving on. I forgot to mention that this is the acetabular joint. The hip joint is the acetabular joint. So you always know that. I want to look at the landmarks of the femur. So you get out of here. All right. We'll just ignore this vertebrae up here. All right. Femoral head, femoral neck, femoral shaft. Coming down here, we've got the attachment with the tibia down here, and we have the patella. I'm going to add the patella on there as well. This is a little sesamoid bone that helps with keeping the tendons straight. So let's go back up to the proximal end and talk about some landmarks on there. Important landmarks. Greater trochanter. So on the humerus, this was a hard thing for me to keep straight. For the humerus, it's a greater tubercle. And for the femur, it's a greater trochanter. Tubercle is a bump, but trochanter is a really big bump. So there it is. Trochanter. This is the lesser trochanter. When we're talking about the trochanter, we're specifically talking about the femur. So that helps you to be able to keep that straight. So lesser trochanter, that's where you've got the attachment for the psoas tendon, iliopsoas tendon attaches there. And on the greater trochanter, we've got a bunch of glute and the deep six attachments happen in there to be able to extend and rotate your hip. So let's see, we got the trochanters, the head and neck, got the shaft. So that means we're going to go down to the distal end. So looking at the knee ball in anteriorly, you're going to go. And so on the medial side, we've got the lateral epicondyle right there. We've got the medial epicondyle right there. And then we've got the condyle on the lateral side and the condyle on the medial side. So that's on the end when you're looking at it anteriorly. Patellar surface or patellar groove, that's what they call that divot right there.
adductor tubercle right there up at the top. You see this like extra bump right here? All the adductors come in there. Now there's an adductor or a few adductors that come down, but they attach to the tibia. So this is just for a bunch of the big, most powerful adductor muscles come in there. Make sure and check out my muscle mastery class if you want to go further in depth about that. If we come around to the posterior side, we've got, let's see, this would be the lateral, and this would be the medial condyles, and that's the intercondylar fossa. Okay, now we're moving on down, going more distal, going to the tibia and fibula. And we're going to keep the foot on there. Okay, you see where this is the fibula, the skinny small one, tibia is the big one. All right, we got two bones here because that helps to like a cushion, having the two bones for distributing all the action. Here we've got the proximal tibio-fibular joint. Going distal, we've got the distal tibio-fibular joint right there. And also the talocrural joint is the whole thing where they attach. Okay, so let's talk about some landmarks for the tibia specifically. So, of course, we've got the head part. We've got condyles. First of all, we call this the tibial plateau. It is kind of a plateau, isn't it? It's a flat space where the joint capsule is going to wrap around. Your femur is going to sit right there on top. So we have that. And then we have this right here is called the intercondylar eminence. Intercondylar eminence right there. In that center spot. Medial condyle, lateral condyle. All right, looking in the back. Medial condyle, lateral condyle. All right, so the fibula sits right below that. This right here, this bump is the tibial tuberosity. That's where your quad muscles are going to attach. This right here is where the pes anserinus attaches. I don't think there's a name. Do they call it anything? I don't know. It's the fossa for the pes anserinus. Let's just call it that. The divot. And then the tibial line is that edge that goes all the way down the shaft of the tibia. Head of the fibula on the lateral part of the tibia when we're looking at it anteriorly. Of course, there's an interosseous membrane. There it is. That's the interosseous membrane right in the center. We've got the lateral malleolus. The lateral malleolus is part of the fibula, and it's the side sticky outie of your ankle. The medial one is on the tibia, and that is the medial sticky outie of your ankle. So that's about it for all what you need to know about the fibula and tibia. And now we're going to talk about the foot bones. So we have, this is the talocrural joint, as I was saying already. Going to take away the fibula, going to take away the tibia. What do we have left? Looking superior view of the foot. Okay, so on the foot we have, get over here. 1, 2, 3, 4 tarsal bones. How many carpal bones did we have in our hand? We had 8 carpal bones, and we have 4 tarsal bones. We start with the talus, calcaneus, cuboid, and navicular. Oh, then we got these, so that's 7. I lied. There's 7 because we have the cuneiforms, medial, intermediate, and lateral. And then over here we've got the first metatarsal, second, third, fourth, fifth. Those are the metatarsals that are inside your foot, just like your palm. And then just like on the hands, we have the same setup with the toes or phalanges. We have on the first toe, which is the equivalent of the thumb, we have proximal and distal phalanges. On the rest of the toes, we have proximal, middle, and distal. So for the toes and the fingers, the bones are all the same. It's just you have to add phalanx of the toe title in order for that to make sense. The joints that go in between The toes, just like the fingers, are called interphalangeal joints. The joint between the tarsal and the phalanges are called metatarsal phalangeal joints. The joints between the tarsals and the metatarsals are called tarsal metatarsal joints. Oh yeah, I want to talk about these sesamoid bones on the big toe. There's your sesamoid bones of the big toe. Just so you know. Anyway, what I want to say is make sure and check out the musculature of the leg and foot so you can see the other bony landmarks that you need to know that aren't listed in the text that I'm working from right now. But yeah, there are some bony landmarks specifically on this edge of the foot, right here and right here. Is there a name for it? No, they don't have that listed in this software. You can include in the comments what that bony landmark is to help us remember, if you can look that up, but I'm not going to do that while I'm recording. And with that, I'm going to go ahead and head out and make sure and get your Atlas of the Bones printout. It's in PDF form, and the link for it is going to be in the description and in the pinned comment. You'll find that there, and it's all been shown throughout this video. That's what you'll get, and then you can refer to it anytime you want to if you don't already have an Atlas of Bones. But with that, I'm going to go ahead and head out, and I will see you in the next video. Toodaloo.